Mastering safe assignments and delegation in nursing practice. Understanding assignments and delegation. Assignments and delegation form essential components of coordinated nursing care, ensuring patients receive appropriate care while maximizing team efficiency. Assignment: distribution of patient care responsibilities among qualified staff based on their scope of practice. Delegation: transfer of specific tasks from licensed nurses to unlicensed or lower-level staff while retaining accountability. Key difference: assignments go to licensed professionals within scope, delegation involves transferring tasks while maintaining responsibility. The 5 rights of delegation. These 5 rights provide a framework for safe and effective delegation decisions. Right task: is the task appropriate for delegation and within the delegate's scope? Right circumstance: does the patient's condition allow for safe delegation? Right person: is the delegate qualified and competent to perform the task? Right direction/communication: are instructions clear, specific, and understood? Right supervision/evaluation: is follow-up ensured after task completion? Understanding scope of practice. Different healthcare team members have varying scopes of practice that determine their responsibilities. Registered nurse, RN, performs patient assessments and develops care plans. Administers all types of medications including 4-push. Makes independent nursing judgments and decisions. Licensed practical nurse, LPN, provides direct patient care under supervision. Administers medications with some limitations. Performs wound care, monitoring, and basic procedures. Unlicensed assistive personnel, UAP, assists with activities of daily living. Takes routine vital signs on stable patients. Provides basic comfort measures and support. Tasks appropriate for delegation to UAPs. Understanding what can be safely delegated helps ensure patient safety and proper task distribution. Appropriate tasks for UAPs. Assisting with activities of daily living including bathing, dressing, and feeding. Taking vital signs on stable patients with normal parameters. Ambulation and repositioning of stable patients. Recording intake and output measurements. Collecting non-invasive specimens. Basic housekeeping and supply stocking. Tasks that cannot be delegated. Certain nursing tasks require clinical judgment and must never be delegated to unlicensed personnel. Tasks requiring licensed personnel. Patient assessments and care plan development. Medication administration and IV therapy. Patient education and discharge planning. Interpreting test results and making clinical decisions. Managing unstable or complex patients. Sterile procedures and wound care requiring judgment. Legal and ethical considerations. Delegation carries significant legal and ethical responsibilities that nurses must understand. Legal responsibilities. State Nurse Practice Acts define delegation rules for LPNs. Facility policies provide specific delegation guidelines. The delegating nurse remains accountable for outcomes. Patient safety must always be the primary consideration. Ethical obligations. Ensure delegates have appropriate training and competency. Provide adequate supervision and support. Report any concerns about delegate performance. Maintain professional standards throughout the process. Effective communication and delegation. Clear communication ensures successful task completion and patient safety. Essential communication elements. Provide specific, clear instructions about the task. Explain expected outcomes and timelines. Identify when to seek help or report concerns. Confirm understanding through feedback and questions. Using SBAR for handoffs. Situation: what needs to be done? Background: relevant patient information. Assessment: current patient status. Recommendation: expected actions and follow-up. Steps for safe and effective delegation. Following a systematic approach ensures successful delegation outcomes. Step-by-step process. Assess, evaluate patient needs and delegate qualifications. Decide, determine appropriate tasks based on scope of practice. Communicate, provide clear, specific instructions. Supervise, monitor progress and provide guidance as needed. Evaluate, review task completion and provide feedback. Common delegation mistakes. Avoiding these common errors helps ensure patient safety and successful outcomes. Frequent mistakes. Delegating tasks outside the delegate's scope of practice. Failing to provide clear, specific instructions. Not supervising or following up on task completion. Ignoring legal and ethical responsibilities. Overloading some staff while underutilizing others. Prevention strategies. Know your state's delegation laws and facility policies. Verify delegate competency before assigning tasks. Maintain open communication throughout the process. Document delegation decisions and outcomes appropriately. Summary and best practices. Effective delegation improves efficiency while maintaining patient safety, but the delegating nurse remains accountable for outcomes. Following the 5 rights of delegation ensures appropriate task assignment based on scope of practice. Clear communication and proper supervision are essential for successful delegation, and nurses must stay updated on legal requirements and facility policies. Key takeaways for practice. Always consider patient safety first in delegation decisions. Maintain accountability even when delegating tasks. Use clear communication and follow up consistently. Stay informed about scope of practice and legal requirements. Thank you for learning about assignments and delegation. These skills enable you to coordinate effective patient care while ensuring safety and maintaining professional standards.